This is Dr. Michelle Loria, and today we're going to talk about communicating your documentation. There are three methods for which you can communicate your documentation. The first is through the signature pane when you go to sign your note. This sends your note out through a documentation distribution server, which honors the provider's reception preferences. The other methodology is through messaging, which can only be used by to send notes to other providers that are using Cerner and have an inbox. And finally, the provider letter. The provider letter allows you to send to individuals who are both in our system and anywhere in the nation. It allows you to attach multiple documents, and it's a very powerful tool. It does not know providers' preferences for how they like to receive their communication, but you can change the communication technique if you want. When you send a note out through the signature pane or through messaging, you can request either signature or review. Most attending providers are always going to want review. I'm going to show you how to determine if your note was sent, and then finally, notes that are automatically sent to the PCP don't need to individually be sent, and those are your admission H&P, your discharge summary, ED notes, and some other specific note types. I've written a note in PowerChart. I'm going to sign and submit it, and this is going to take me to the signature pane. In the signature pane, I can choose to create provider letter. I can also send it directly to other providers, and it will respect their communication preferences. And this is going to send my note to Dr. Ross, and you can see it defaults that I'm sending it to Dr. Ross for review, and that's because I'm an attending physician. Again, I can also select Create Provider Letter. A couple other things to notice in the pane is that I can look at a list of everybody that has a relationship with the patient, so that might be quick and easy for me to use. This is a test patient. I can look at who I've communicated with recently. It will let me know who I like to communicate with, and then I can also save different folks as favorites to communicate with if I'm always doing a lot of notes or consults for them. This is the provider letter tool. The provider letter tool opens up looking at our internal dictionary. This is our dictionary of providers that are both within EMHS and outside of EMHS that we curate. You should always look here first because this is a curated list. It also gives us access to a national dictionary, which is the NPPES. This is not a curated list. My 84-year-old mother is still on it. So always look in your internal list first. It will also automatically display the PCP on top. Remember that your discharge summaries, admission H&Ps, and ED notes are automatically sent to the PCP, so you don't need to send them again. It allows me to save favorites, and I can choose my favorite to add, and I can forward it to print and send it to a secretary. I can also add comments. Once I'm done selecting who's going to get it, you'll see that I still need to attach a document. Even though I just came out of a signature window, it's going to pull up the document I just did, and that's because it allows me to, if I want to, only send part of that document. I don't have to attach the full document. I can highlight a part and just say attach the text selected, or I can attach the full document. You can see here that I have all these other documents, and I can also attach these. Let's say I want to send a lot of information to this provider, and I can click OK. I can also attach results, and I can attach any result that exists in Cerner to send to the other provider. I can put in a cover letter if you want. I could have auto text that puts in my common phrases. You can see I've got the auto text icon here. I can see all of the system auto text, and I can see all of my personal auto text phrases. I can also finally preview what I'm sending. And it will show all of the attached documents, my cover letter, and all of my attached results. In order to see who a note was sent to, I can preview the note and I can pull up the bottom part of that note, and I'll see an action list, and I can see what was requested and if it's been reviewed yet. So I sent it to Dr. Ross for review. This can be useful if you're trying to go back and recall if you have previously communicated to an individual. Finally, the last way that I can communicate with folks is through Message Center. I go to this Communicate button. You can see provider letters here, and I can also go to Message. What's nice about messaging is you don't necessarily have to have a patient in there. So if I were on call and I took a phone call about a patient that didn't have a medical record number, I could document what I said on that phone call here in Message Center, send it to myself, and then wait for that patient to get a medical record number through registration, and then save that to the chart. I could also send that documentation of the information I received maybe to the next person coming on call, and then they would have it. And then once the patient got a medical record number, they would be able to see the information. Thank you very much. This concludes our presentation.